Hi, this is Anita Finley, and I'm going to introduce a very exciting new show for us, and it's really called Dr. Rosemary in the Afternoon. And you're wondering, who is Dr. Rosemary? Well, she's a very special person. It's Dr. Rosemary Mencia. She is a dentist at the Adult and Geriatric Institute. They're located in Fort Lauderdale. And for those of you who have been wondering about dentists and how even they got in that field, and the biggest question is, why would they get in that field? And I have friends who say, I'm afraid to go to the dentist. So we're going to start off. We're just going to jump right into this. Dr. Rosemary, why is it that some people are afraid of dentists?
Well, the majority of the time, they're afraid because of something that happened when they were younger. They had a bad experience with a dentist. Either the dentist was rough with them or the dentist didn't wait for them to get them. There was some kind of bad effect or bad experience that always lingers to their adulthood. And they never forget that traumatic experience, and that always basically makes them afraid.
Okay, so now they come into your office, and do they say that I'm afraid? Finally someone twists their arm and they heard about how wonderful you are, and they come in. And so what do? Do you just hold their hand or what?
Well, they always do say I'm afraid. That's the first thing they always say. And what we do is we do speak to them. We kind of coax them, and we tell them that, I do pride myself on being very gentle with my patients, and I really take my time. One thing I like to do is I like to speak to them a lot. I speak to them. I let them know what the experience is going to entail, and I really, when I am going to do something, whatever dental work I am going to do, I really take my time. One very important thing is when the patient is going to get numb, I really take my time getting the patient numb. And a lot of dentists do not wait and do not give the patient the adequate amount of time to get numb. They may give them a few minutes, give them an injection, okay, and they're ready to start the work in, less than a minute. That really doesn't give the patient enough time to get numb. So I really, if, the patient needs half hour, some patients take longer than others to get numb. So if the patient needs half hour, we have television in all of our rooms. The patient will sit down. They'll get comfortable. I was just doing an extraction the other day. The patient, she took about 45 minutes to get numb. But, she sat there. She was comfortable. She was very anxious. She relaxed. And after about 45 minutes, she was numb. We got the tooth out. And, she was very grateful because she was afraid when she came in. By the time she left, she had her tooth out. And, she wasn't afraid anymore. So you really have to be patient with the patients. When you're not patient and they're anxious, then it just makes a bad situation worse.
Well, now that I was listening to you, I was this beautiful woman standing here, this dentist, I thought, when her parents said to her, well, what do you want to be? And she probably said, a ballerina, most people. No. This young woman said probably, I want to be a dentist. How did that all happen?
Well,
or didn't it happen like that?
No. When I was younger, about 17 years old, we had some friends who were dentists, and they asked me, can you come and just help us out in our office? Because their assistant was on vacation. So I went there just helping them out and just observing in the office, and I liked what I saw. I really did a lot of things in the office. I enjoyed what they were doing with the patients. I enjoyed the way they were helping patients. Patients would come in pain. They would really do a lot. Patients would leave. It was immediate satisfaction for a lot of the patients. And this was something I wanted to do. So I went to college. I completed college in 3 years. Then I went on to New York University Dental School. I finished. And it was something that, it was a great experience for me. I loved it. I practiced in New York first. Then I moved to Florida. We've been here for 15 years now, and I would never look back.
And I'm thinking about dentistry. I have little triplet grandchildren, and they're just 6. And all of a sudden, when I was there the other day, they started showing me each one had a little tooth that was loose. So I said, do you want me to pull it? No, I don't want to pull it. So I said, I guess it's going to come out. I said, do you have the little pillow for the tooth fairy? So, when you start with the little kids like that, they probably don't have any serious work that needs to be done, right?
As long as you start them young. As long as the kids, they go to the dentist when they're young and they start going to the dentist when they're young, no, they don't usually have any work. It's when nowadays we don't really see a lot of kids with a lot of serious work because they start going when they're so young. They start going when they're 4 years old, 5 years old, and they're taking such good care of their teeth. The parents are now so bright. They know, they're so educated, and they really know what to do now. So it's not like years ago when parents really did not know what to do. They didn't have the knowledge. So we had a lot more cavities. Back then, water wasn't fluoridated. It wasn't like it is now. So the kids nowadays do not have cavities like they did years ago.
All right, so let's just say, though, that the kids are doing okay, but let's just move up a little bit to the adults. There are adults that I can hardly get close to because they have odor in their mouth.
Right.
And is that caused by teeth, or is that just an illness?
It can be one of two things. It can be their teeth. It can be because they have decay in their teeth, and decay can cause an odor. It can be from their gums. They can have periodontal disease. Periodontal disease can cause odor, because periodontal disease is really an infection of the gums, and that can cause an odor. It can be their stomach. They can have gastritis or, regurgitation in their stomach, and that can be causing an odor. So it could be a few things. It can be they just haven't had a cleaning. When a patient comes to me and they say, I have bad odor in my mouth, the first thing I'll ask them is, when was the last time you had a cleaning? Sometimes they'll say it's been a year, 2 years. So we really start with the simplest thing first. Get them on a regimen where they're getting a cleaning every 6 months, more often if they need it. And after that, then if they still come back and say, Doc, I'm still having a bad odor, then we'll look a little further, especially if they have no cavities. Then we might say, well, have you seen your medical doctor? Is there anything going on in your stomach? Do you have any kind of regurgitation, any sort of, anything like that?
Okay, well, I just want to tell everybody, if you just tuned in, we're talking to Dr. Rosemary in the afternoon. And Dr. Rosemary Mencia is our star today. And we're hoping that we're going to be able to do this every week. You're going to learn a lot about dentistry before we get finished. Their office is the Adult and Geriatric Institute, and it's located 1608 East Commercial Boulevard in Fort Lauderdale. This is the phone number. Remember, this is Pencil Talk Radio. Get the phone number down because you'll want to make an appointment to go and see her. 954-489-1345. 954-489-1345. I know Dr. Rosemary fairly well now, and she is very kind and very loving, and everything she has told you, when you go there, you will not only get the fine dental work, but you'll also get a very loving person, and combined, that really works. There's so many things that I'd like to talk to you about, and I can just start off with a few things, but let's just talk about people who have teeth that are not very white. And everybody wants to have white teeth. You see that on television, all this white teeth. Talk to me about that.
Okay. What we offer, there are several ways of getting white teeth. What you can do is, if your teeth are simply just yellow and you want to whiten your teeth, the simplest way is, of course, bleaching your teeth. And patients a lot of times will ask me, does it cause sensitivity? Does it damage the enamel? And the straight answer is no, it does not. It would not be on the market. We would not be allowed to do it if it damaged your teeth or if it, caused extreme sensitivity. You might have sensitivity for a couple of hours. You might have sensitivity for a day or so, but any kind of long-term permanent damage, it does not do. The system that we do is called Zoom. It takes about 1 hour. It basically will get your teeth as white as they will go. It's kind of like I tell my patients, it's like sitting in the sun. If you sit in the sun for 3-4 days, you're only going to get so dark. You're going to get as dark as the amount of melanin you have in your skin. You can sit as long as you want. You're not going to get any darker than your skin tone will allow you to get dark. Same thing with your teeth. Your teeth will only get as white as they will go. My teeth maybe will get whiter than your teeth will get, Anita. And we will go through the exact same procedure. So your teeth will only get so white. This system will get your teeth as white as they will go. The procedure entails sitting under an ultraviolet light. We basically mask your gums, we mask your lips, and we put some gel on your teeth. You sit under this light for 1 hour, and it's a series of 20 minutes. We put the gel on, then we wipe it off, and your teeth really do get significantly about, I would say, 6 shades lighter. Most patients go about 6 shades lighter.
Well, that's a lot, really, and that's very exciting. So if someone would come in, then you can discuss that with them, and you'll know, what you should do. But you wouldn't really want to whiten their teeth until you work on their teeth and make sure that their teeth are in good condition, would you?
The first thing we do usually is, I like to look at their teeth, make sure their teeth doesn't have a tremendous amount of plaque buildup. Somebody who hasn't been to the dentist for a year or 2 years, the first thing you want to do is clean your teeth. You want to get your teeth clean. You do not want to whiten your teeth the same day, because then you will have a lot of sensitivity. You want to clean your teeth and come back another day for the whitening. You don't want to do that on the same day. Then if you have any place you have rampant decay, you have a lot of decay, you do not want to whiten your teeth. You want to first take care of that decay. Why? Because you don't want gel seeping into places where you have decay. So really on the outside, you don't want to just say, well, I want my teeth to look beautiful on the outside, but yet when you open your mouth, it looks like a train wreck. So
I heard that.
It's really, really important that you take care of what's in the back. I've had patients who have come in and they just want their teeth to look beautiful on the outside, but they really don't care what's going on the inside. But that's really not important, because what goes on, remember, your oral cavity is the pathway to the rest of your body, and it's the entryway to your body. So whatever goes on in your mouth, you have decay, you have gum disease, all of that goes into your body. So it's very, very important that the oral cavity, and I really push this to my patients, I spent a lot of time educating each and every one of my patients on not only good nutrition, but really on keeping their teeth in the best possible health that they can. And when I say the best possible health that they can, I mean everybody's finances, I understand, are different. So everybody at a lot of times cannot do everything. But really I try to educate them to keep their teeth in the best condition they can, because when they have teeth that are rampantly decayed, that bacteria can go and get into your blood. And there's so much research now that is showing that affects people with diabetes. It affects people with heart disease. So I'm a really big proponent of educating patients, and I feel knowledge is power, on them to know that really your mouth, your oral cavity has to really be in good health. It's not like, well, it doesn't hurt me, why do I have to fix it? I don't believe in that. I really push my patients to try to do what they can do. And we work with them. Financially, we'll work with our patients, trying to help them to pay for what they can afford. If they can't afford it, again, we work with them. We have a great office manager, Mike, who is an expert at insurances and just really trying to come up with very creative financial plans.
Yeah, I hope that doesn't keep you from going to see Dr. Rosemary, because she really is an excellent dentist, and she cares. You start to put those two things together. No matter how busy she is, I always see the way she treats her patients. The other thing that you mentioned, Dr. Rosemary, was when people come there, they can also have some other medical services. That's the reason It's called the Adult and Geriatric Institute.
Right. We have on our staff, in our office, we have also a medical doctor, and we have different specialties over there. We have in the same building, we have neurologists, we have cardiologists, we have anesthesiologists, we have dermatologists, so it's really a comprehensive medical center. So a patient can come and can get several appointments down at one time. As far as some people may think, well, how does that help me with going to the dentist? Now, it does help, because to give you an example, I had a patient who came to me last week and needed an extraction. The patient was taking Coumadin. For those of you who don't know, Coumadin is a blood thinner. So your blood has to be at a certain level in order to be able to do an extraction. Otherwise, you may bleed excessively. So the patient was in pain and needed to have the extraction, but he was just taking Coumadin the day before. So we didn't know if we could do the extraction that day. The only way I could have known was had we done a blood level and check to see what his level was. Most dentists will not have this machine in their office. So I called up one of the medical assistants from the medical department. They came up, checked the level. The level was just right, so I was able to do the extraction that day. Otherwise, the patient would have had to go home in pain, stop the medication for 3 days, came back 3 days later, and then had the extraction. So the patient was eternally grateful that he was able to have this procedure done that day and never could have got this done in just a regular dentist's office.
Well, something that you mentioned, Dr. Rosemary, and I think it's really important, it does make a difference for someone to come there and have different services because, look, you and I jump into our car and we take off.
Right.
A lot of people, as they age, they have to have someone bring them. They can't do that. So they come, because I remembered I was in the hearing aid business, and if they didn't have their hearing aid, their ears cleaned first, they got to the hearing aid department and they turned them away. They said, you have to go home, you have to go see a doctor to have this done. So it's a wonderful thing that you have all these specialties.
Absolutely. Or their child has to take off of work several times, or if they have to pay a taxi, they have to pay taxi fare several times. So it really makes it very convenient. There are so many times I hear from patients how grateful they are, or from their family members how grateful they are. So it really gives me great satisfaction because every time I hear this, I know what a great service I'm doing. I may go home exhausted, but you know what? I go home with such a sense of satisfaction because I know how many people I did the right thing for every day.
I am sure that's true, and Dr. Rosemary is very caring, and what she says that she really means that. And on a next show we can maybe get into sedation dentistry because it's a big subject, and I want to stay a little light for our first one. But I'd like to ask you also about people who come in and maybe they have a little chipped tooth. They just want to look better, but it's not. They don't want any teeth being pulled. They don't want to get new, no implants. Is there not some sort of a cosmetic filler that you can make their teeth look even?
Yeah, we do bonding. We do all the fillings. We don't use silver fillings in our office. We do all white fillings. So if somebody comes in and they just have a little chip, they just need some, bonding, they're not in the market to do, let's say, crowns or veneers or something like that, we're able to just fill their teeth or make their, close spaces, do anything with just bonding. Again, I work with every patient. I'm not here to sell to patients, the $10,000 treatment plan. I really am here to work with every patient. I've had many patients who have come to me because different dentists have tried to sell them huge treatment plans. And they've come and they say, can I have another opinion? And really, when you come to me, we're trying to work with the patient. We're going to give them something that they need for a great quality of life that is going to make them happy, and we'll do what you want. Those patients that want all the veneers they want, the Rolls Royce, we're happy to deliver a Rolls Royce.
Stop you. I really don't know what a veneer is.
Okay, a veneer is a porcelain facing, meaning a crown will cover the entire tooth. Okay, so we really recontour the entire tooth. When you have a big filling in or you've broken half of the tooth structure, we recontour the entire tooth, and then we put a porcelain jacket. They call it porcelain jackets, caps, or things like that. That's a crown. When you don't need that and you just want to cover the surface of the tooth, just like an acrylic fingernail. Right. That's exactly what a veneer is. And a veneer is the same thing as a fingernail, an acrylic fingernail for teeth. It just is basically a porcelain facing. So you cover your teeth. Instead of putting, let's say, bonding on, you can just put 4 porcelain facings on all the front of your teeth.
Oh, that must be interesting.
Yes.
Does it make a big difference?
It can make a tremendous difference. You can make it any color you want, any shape you want, anything you want. You can change the entire look of somebody.
You must have a very important or very high-tech computer system to be able to look at their teeth and their whole system.
We do. Everything is digital. Everything is computerized.
So you figure out ahead of time what you have to order. Now, do you show them what they're going to look like?
Yeah, we speak to the patient. We let them know exactly what they want. We spend a lot of, my first appointment, I spent a lot of time with the patients, a lot of time trying to get to know the patient, trying to understand what the patient wants. And then once I know what the patient wants, what the patient really, because sometimes the patients don't know what they want. So really, you want to really understand. You want to give patients all the options. I spend a lot of time giving patients 3-4 options so they understand what all their choices are, what each one entails. Some take more time, some take less time, because a very well-informed patient is really what you want. Then once they know all the options, then they can make an educated decision. I don't want anybody to be rushed out. And then afterwards, when they know what their choices are, they can ask all the right questions. Their families can ask the right questions. And after that, we then decide what we're going to do with the treatment.
You know, in our future shows, we're going to be talking about all sorts of issues, some very serious ones, having root canals, certain kinds of oral surgery, having dentures, and what the latest on that is. And some of you now have a lot of work that was done before, and you probably have silver fillings, and I think that would be like a whole comprehensive examination, and I know that Dr. Rosemary will figure out, along with you, what you would like. The thing that I say, though, is, and I know another subject going to be diet, because you're very good about nutrition and how that affects. We have a lot of subjects. So if any of you are interested in talking with Dr. Rosemary or making an appointment, let me give a phone number again. It's 954-489-1345. Again, that's 954-489-1345. And I want to just tell everybody, everyone's hot about coming to the Boomer Expo. The buses have lined up. I think the last count was 53 buses. I don't know how everyone's going to get in, but we're going to figure it out. And Dr. Rosemary will be there along with her associates, and Dr. Mencia will be there. The Adult and Geriatric Institute will be there. We have so much happening, and I know she'll love to talk with you, and you can smile at her, or as many people do. Dr. Rosemary, they talk with their hand over their mouth, and you know why they do that, of course. You, of all people, would know that.
Yes, a lot of people do that because they're embarrassed. They're embarrassed. First, they have sometimes bad breath, and they don't want, people to smell their breath. And second of all, people are embarrassed sometimes of their teeth, and they don't want to show their teeth. So I have a lot of people that, when they come in, they sometimes ask me to close the door because they don't
close the door
because they don't want anybody to see what their teeth really are like.
Heavens.
Yes.
Oh, that's very sad, isn't it? How did they get that way? I mean, did they just not
take
care of their teeth?
It's been either years of neglect, or sometimes it's been a bad situation with another dentist. You would be very surprised, Anita, how many patients have had a bad situation with another dentist. It's very sad. So, life goes on. They stay like that because they've gone to this dentist, they've gotten the treatment and whatnot, and they've withstood it, and then,
Have you ever had someone come in who absolutely had, as you said, maybe a bad situation with another dentist, or someone who just did things and you didn't agree with it, and you just look at it and you probably shake your head and think, oh, wow, this poor person, what they've been living with, and then you have to figure out how you have to undo what they've done.
Lots of times.
Lots of times.
You
looked at me like at first I thought, no, never. Then she looked at me and says, lots of times. Why? Oh, that's too
lots
bad.
of times.
I'm sorry to hear that.
It's better. I don't even comment any further.
Okay.
But
but
lots of times.
All right, well,
more than I wish.
Yeah. Well, that's. I guess that you could say that about in a lot of fields. But with you,
one thing I just want to add is that, my office is, here. If anybody ever wanted to just come in and just ask a question, we're here just to even, if people just wanted a consultation, we would be happy to just give a complimentary consultation. People come in. Sometimes people want to just come in because they're not sure. They're going someplace. They just want to know, is this the right thing? Am I going through the right thing? Or, does it seem right to you? Because patients are not educated, and I have to be very educated when I mean educated dental-wise. And I have to be very honest with you, dentally, it's very easy for a dentist to tell you need this, and this, and the patient can never know the difference. So really, anybody listening that, is just not sure, I'm very happy for someone to come in, and if you just call my office, speak to Mike, I'm happy to spend the time. Just come in, talk to me. I do lots of times. I will do a consultation for somebody at no charge, just to try to help them, not to get you to switch over, because I'm not interested in stealing patients from anyone, but just to try to help someone. If I can lead you in the right way and just give you an opinion as to the right thing, the wrong thing, whatever, I would be happy to do that.
And I know that she really means that. But I have a lot of questions I've been saving up for you. When I have dental work done, sometimes I find that if I take a cold compress when I leave the dentist's office, and then I have a cold compress right on my cheek, it doesn't swell, and I don't have any problems. But a lot of times, people who don't do that, they wind up swelling and they suffer. What is happening there?
That's because they've had work done. There's you have all the blood circulation in that area. So when you put the ice on, what you're doing is you're just kind of causing all the vessels in that area to constrict. Now, the trick is when you put the ice on, you only want to put the ice on 10 minutes on and then maybe 10 minutes on. You don't want to leave the ice on for like hours at a time. You want to maybe just leave 10 minutes on, 10 minutes off. 10 minutes on and 10 minutes on. And I'll give you one more trick. There's something called arnica, Arnica, and you can buy it from Whole Foods or any kind of whole food, any kind of, natural health food place. And it's something homeopathic. And if you put that on when you've had an extraction, you've had any kind of bruising or anything, it will prevent you from swelling or any kind of black and blue.
That's a natural remedy.
Yeah, natural. It's a gel, and it really just helps you for any kind of bruising. I'll tell a lot of my patients if they have an extraction or an implant or something, when they have, any kind of work done, they put it on, and the bruising is really to a minimum.
Well, I, of course, know a lot of people who are having these problems, and, of course, I am now recommending that they all go to you. They have all sorts of problems with their teeth, and one of which was someone holding their hand over their mouth. The other one needed a root canal. They need all this, but we certainly are glad that you're going to be doing this, and we are hoping that everyone's going to start listening to you. We're going to be on, of course, on the web at the same time. And we are going to have you back again next week, Dr. Rosemary, in the afternoon. Thank you very much.
Thank you, Anita.